it's a chance. It's a chance to have a better life. It's a chance to live longer. And why would you pass that up? My name is Nancy, and this is my husband, Lee, who happens to be a family physician. And I was diagnosed with COPD 11 years ago. We're members of AMAC. And I was looking through the magazine, and you had a full-page ad. I gave it to my husband. I said, read this, tell me, what do you think? He says, why don't you call the number? Call him tomorrow. So I did. I said, my husband is a physician, and could we possibly talk to could he talk to a physician about it? And she said, I'll make the arrangements.
We talked for about 45 minutes. I asked all my questions. It perked my interest, and there is nothing that you could offer a patient like Nancy. Medications, are helpful, but they don't make anything better. And at least from my perspective, I thought it was worth a try.
It was really amazing. I had been told not to expect anything, to give it at least 2 weeks. But I felt like I had more energy by that afternoon. I think where my husband saw it, I think where Lee saw it, was when we got home, I walked up the stairs. Now see, it's a simple sentence, but I didn't pull myself up the stairs. I walked up the stairs, and he noticed.
Yeah, because in the past, she'd take a couple steps and stop and, just kind of slowly get up the stairs, and she just walked straight up the stairs. I just think that anybody that's having struggles on top of maximum medication should consider this, and I would just explain to them that there's, in my mind, no downside to it, and they definitely ought to consider doing it.
I have this bracelet. It keeps track of my heartbeat and my steps and things like that. Before I got sick this winter, I was pushing to get to 6,000 steps a day. Now, when I got so sick, I was lucky if I got in 500 steps a day. Now I'm pushing to get into 2,500 steps a day. So I'm moving up. And if you want to call that a hobby, I will, because for me, that's a big deal to be able to walk around. And I want to get back to 6 and push for 7. I was really in bad shape this winter when I got so sick. And they're bringing me back. It felt wonderful. It felt wonderful. I wanted to go back right away and have another treatment. I wanted to have a treatment every day. So, no, it felt wonderful. It gave me hope, and that maybe I was going to be able to maintain some kind of a lifestyle.